This is a program from People's Hospital and engage many doctors and the directors from cities of the province to develop their skill and their ability to be a leader or trainer of general practice in the next 5 or 10 years. So one of the very big and important topic is about mental health. Mental health is an area that very important for the medical area, but also a kind of very, very big impact on the well-being of people, of the human being, any country of the world. So I'm very happy to invite Professor Grant Belansky. Grant to have introduced himself, and then we talk, have more conversation about mental health.
Yeah. So hello, and really good to chat to my good friends in China and old friends and maybe some new friends. 我会说一点中文。我是医生，我是家庭医生。我是墨尔本大学的教授。And 我出国中国，我教家庭医生。And 会让我的翻译我的同事非常好。So 谢谢你。And 现在我会说英文。
Excellent. I think your Mandarin speak very well, and you need more improvement.
I do. I very much look forward when we can travel again and come back to our friends in China.
Unfortunately, we cannot travel China currently because the COVID pandemic. But I believe we will be there to meet our Chinese friends there.
Yeah, we look forward to seeing our good friends soon.
Yeah. Okay.
So about me, I am GP. I have been working for about maybe 25 years as GP, and also academic, associate professor at the University of Melbourne. And I'm very interested, especially in mental health. Maybe someone could say it is a little bit in my blood because my father, he worked as GP, also interested in mental health, and then he became a psychiatrist. And with my good colleague, Professor Hui Yang, we have done many trips to China and also had many visitors from China, and having a good exchange of ideas about general practice and also especially the importance of mental health work in general practice. So thank you, Hui.
Thank you, Grant. That's a very beautiful introduction. And we know that you are very famous general practitioner. That's very special interest on mental health. So basically, you are GP. You always introduce, I'm a GP. I'm interested on mental health. So I believe you, in your practice, in the routine practice, you have met many patients that have mental problems or they need help. The clinical encounters of mental health problem is not rare for you. So could you have some introduction, have some, you needn't tell the real name, but to pick up some case in your clinical experience, like what kind of patient you see that they require mental health help or they have a mental health problem? And what's that link their life, their community, and what's the situation, and what's the consultation happened in your office?
So I will give you, first of all, example, a young man or middle-aged man, 32 years old, and he comes in, he has a lot of muscles, like he is a builder. And he actually took some hormones, some steroids to make his muscles bigger. Some of the men do this, but this also affected his mental health. And he ended up with depression. And unfortunately, he also had quite a lot of suicidal ideas. And when he came to see me, we were pretty worried about him. His life was falling apart. He lost his job and his girlfriend left him, and his mother was on the other side of Australia. And so I was pretty worried about him. Intelligent man, nice fellow, otherwise pretty fit and healthy, not on any medication. And so I was very concerned about this man.
So what's his complaint? What's his complaint for visit you?
He comes to see me actually because he cannot sleep. He says, I'm not sleeping. But actually, when we get talking, he was thinking that he didn't want to stay alive, that he wanted to take his own life. And I was pretty worried about him. And so maybe for our Chinese doctors listening, they would know as a GP, when a patient comes and has risk of suicide, this is very frightening for the patient, also frightening for the doctor, trying to work out what can I do to help this person, make sure they're safe. And so this was the first case that I wanted to mention to you, a sort of patient we can see in general practice.
So it means you see some patients like this, the Mr. X, he is kind of very deep depressed. And he have some, the reason of encounter is not good sleep, but actually have a lot of appearance about mental problems.
Yeah, and I think this brings up a good point for our colleagues that in Australia and even maybe more in China, I know people don't like to talk about mental health issues. So instead of coming in and saying, I have depression and I have suicide thoughts, much more likely the patient would come in and say, oh, I am very tired, or I cannot sleep, or I am getting very angry, or something more like this, more acceptable for them to speak to the doctor. But actually the problem here was depression.
I believe a Chinese doctor also can see some similar patient like this man.
Yeah, and we know from the statistics, it's very sad. In Australia, in any 1 year, 3,000 people take their lives in 1 year. So that on average, 8 people every day, and 6 of these 8 will be men. And it is the most common cause of death in Australia for the 25 to 44-year-old man. The most common, unfortunately, is suicide. So we take this pretty seriously when someone talks about this.
Okay, this is a very important case. And, the Chinese audience very like to listen to story. So what's the next story you share with us?
Yeah, so we might come back to a little bit how you go about managing this fellow, but just to give you a feel of the sorts of patients we see.
Sure.
So here would be another typical patient. She's a 30-year-old lady. She is a nurse. She has a lot of anxiety, and she's using a lot of benzodiazepine medicine, like what we call Valium, the benzodiazepines. Actually, she takes them for quite a few years, and now she is addicted to them. Like she feels like she has to have them. She has tried to stop them, but then she gets a lot of anxiety. She tried antidepressants, but they make her feel sick. She has seen psychologists, but still she has a lot of anxiety. She has past history. Her mother, unfortunately, had a lot of mental health problems. And maybe a lesson here as well, very important to ask about the family history, because in her case, I think there is a fair bit of mental illness running in her family. So not only her experience from her mum, but maybe her genetics to make her a little bit more at risk to have some mental health problem. So in her case, we have anxiety issue, and addiction to benzodiazepine medicine is secondary problem.
So this patient, you know her a long time, right?
Yeah, and this one of the great strengths about the general practitioner is I know her for about 10 years. So we have a good relationship and she trusts me. and we are trying all different things to help her.
Okay. So this is an anxiety case.
Yes. Yes.
So is that which one is more popular? Depression and anxiety?
Well, what we know in Australia, in any 1 year from the big national survey, we would expect that we are getting about 5% of population. So maybe 1 million people have depression, but maybe 2 million have anxiety conditions. So anxiety is the most common mental health condition in Australia and most countries. This case is more generalized anxiety, but anxiety also includes panic attacks, OCD, obsessive compulsive disorder, post-traumatic stress also. And, you know, in Australia, but a lot of countries around the world, there've been a lot of traumatic experience. In Australia, we had bushfires, floods, and, you know, so some people get some post-traumatic stress problems, also very common.
I think this global environment is a kind of things like make people stressful.
Yeah.
So especially current. What do you think about? Do you find some new case like the patient have some impact on the pandemic of the COVID-19?
Yeah. So in Australia, thank God we manage the COVID pretty well now. We have very few cases. We are recording this now in May 2021, and happily there's just a couple of cases in Sydney, but not very much, you know. But definitely last year, we had a lot of stress in the community, especially where we are in the southern part of Australia in Melbourne. They locked down Victoria for maybe 100 days, maybe more, very severe restrictions. And this caused a lot of stress for people. For some people, the stress was, I am in my home with too many people, with my partner, my children not going to school. And so the household get very stressed from too much activity. On the other hand, some people very isolated, so that they were stuck at home, not have partner, maybe their families interstate, or we also, as you know, had a lot of international students in Melbourne and Sydney, and some of them were very isolated from their family at home. So I think a pretty stressful time, actually, for many people from the COVID-19 pandemic.
So it's not uncommon. This is not uncommon.
Yeah, at Beyond Blue, where I am working. So maybe your doctors don't know what is Beyond Blue, but it is National Mental Health Organisation. We provide telephone support line for anyone. Any Australians can call this number. We get maybe 200,000 calls a year. During COVID-19, we had a big jump in calls, maybe 40% increase. So a lot of people very stressed during the pandemic.
Okay, so you talk about the case of depression and talk about the case of anxiety, includes the COVID-19 pandemic, like phobia, COVID phobia, something like that. So any other case like that different than that?
Yeah, so I thought maybe one last case to talk about is what we call somatization case. Somatization means the patient has mental health issue, but they are presenting to the doctor mainly with physical symptoms. So I have a very nice man I looked after for many years. He is, let's say, 65 years old. He worries about every health problem. You know, actually, he's very healthy physically. But, you know, he is checking his blood pressure, wants to come every week to do blood pressure check. I go, yep, it's still good. And he is worrying if he gets a little chest pain, maybe something serious or something he noticed on his skin. But he has a very anxious personality, what we call health anxiety. And so he is very focused on health problems. And so he comes to me very frequently. I think Actually, it's sort of his personality. He has what we call dependent personality. So very reliant on his wife. He's not working, and he makes many doctor's appointments and worrying about very small health concerns. And then we do check up, and it's very hard to reassure him. So this is more a case of health anxiety.
So this is called, you call the somatization. It's very popular in general practice settings.
Yeah. So these three cases, they're, pretty common in general practice, and actually Australian general practice practitioners are an important part of managing the mental health problems in Australia.
So we are, you may know the TCM, the traditional Chinese medicine. It's a kind of philosophy of the Chinese people. Most people believe TCM is working. It's not only about herb, but also the theory. One of the theory from TCM is that the body and the mind exactly linked together. So it means when the people come to you to see the physical problem, they must have simultaneously have the mental problems. So like the pulpitization is a kind of link with anxiety, similar like this case. So is that a somatization is a similar concept like that?
Yeah, and this is why I think different cultures have different views about health. And we know that the Chinese culture and beliefs are going to be pretty different to the Western culture beliefs. And this is sort of important, especially when we're talking about mental health. So I think that from my little bit of understanding of TCM and Chinese culture, they have a good understanding of the connection of mind and body. Even so, I think maybe because of the stigma of mental health, the embarrassment of mental health, that many patients in China still, even if they have mind issue, still may be more comfortable to go to the GP. I am tired. I have back pain. I am not sleeping, because then they feel more comfortable. And my impression in a lot of China is that people aren't very likely to come in and say, I have mental health issue, I have depression. I think also maybe you'll understand, and I know we're going to talk a bit about China and Western countries, but I think, a lot of the problems we're managing in general practice are, common community issues, depression, anxiety. Whereas I think a lot of people, when they think of mental illness, generally, but also especially in China, they think more severe psychiatric illness. Maybe this person would need to go to hospital, like much more up that severe end. Whereas GPs in Australia are managing a lot of people with, still a big problem, but not usually that they need to go to hospital. They can manage in the community.
Yeah. I think you're right. And also in China, as my understanding, many ordinary people, or even some health professionals, they have difficult to distinguish the psychology and the psychiatry. So they think that, as you said, if they're told a mental problem, this is a kind of mad, it's a kind of disaster, it's an aggressive man and very dangerous, should be put in jail or something like that. So it's kind of misunderstanding. It's not only the culture, but also the knowledge about there are different disciplines to describe or to manage the problems.
Yeah. And look, in Australia, we also have severe mental health issues. We have people who, may have schizophrenia, psychosis, severe personality problems that, might need hospital, in some cases may need community or police intervention. So it's not that we don't have these cases. These are looked after also. But I think a lot of the GP work is the more depression, anxiety, and also a little bit of alcohol use as well is something pretty common that the GP is managing too much. So I think that's a useful way to think about the different sorts of patients.
So in your practice, when you see some patient with mental health problem or need help, so what's your tools? What's your way to the approach to help them? Do you handle themselves by yourself, or do you refer to them to a specialist, like a clinical psychologist, or even hospital psychiatrist department? So, what's your approach?
Yeah, it's a good thing. So, the first thing to say is the research tells us in Australia about 50% of people with mental health issues, they don't get professional help. They try and manage themselves. Maybe they just drink alcohol. Maybe they are fighting with their boss or their relationship break up, but they're not really getting medical help. So it's about half of the people. But then the ones who do get professional help, most of those are going to go to the GP, and the GP will manage some of those themselves, and the more severe ones they refer. And in Australia, we're very lucky that we've got pretty good referral pathways. So the GPs in Australia undertake a structured assessment called a GP mental health plan. So this is a list of questions that we're going to ask the patient. Things like, did you have mental health problem before? Are you on any medication? Are you having suicidal thoughts? Does mental health problems run in your family? So these sort of questions. We also get them to fill out a psychometric tool, usually one called the K10. It's like 10 questions. So this will give us a score out of 50 about how their mental health is going. So this can be a very useful structured assessment from the GP. Now, also, if I am concerned, I can refer the patient to psychologists. So we have government funding support for the patient to go to a psychologist if they need, initially for 6 consultations, and then if need be, some more. And also if we think, hey, this is more severe, this is someone at risk today at risk of suicide to themselves, at risk maybe of harming someone, we have what we call the CAT team from the hospital, community assessment team. They will come and they will assess the patient at the clinic and make sure they are safe. And if they are concerned, maybe say, listen, you should come to hospital. So you can see it is like different levels: GP, psychologist, if need be, hospital psychiatrist, if more serious. So at Beyond Blue, we have 2 documents that may be useful. One called A Guide to What Works for Depression, and another one called A Guide to What Works for Anxiety. These just were produced by academics at the University of Melbourne, and they review all the evidence for the common treatments, for medication, psychology treatments, and complementary treatments as well. And this means that they're available to the general public. They can have a look, what treatments actually help me get better.
Oh, great. So I'm very happy to have this document and share with Chinese colleagues. And you just in the very beginning of this talk, you said you have a big influence from your father, to learn the mental health knowledge. And also, I found you and your colleague wrote a very good book like this, The Mental Health, General Practice Psychiatry. And also this book translates into Chinese, like the General Practice 全科医学之心理健康. This is a very good text and very good work for GP. And they can read this book and understanding what's the problem and how to handle the problem in general practice and primary health care.
Yeah. So this book, first of all, we need to say that I think the GP is a very good person to manage mental health issues. Yeah. So in Australia, I think very recognized as someone good to go to for mental health care because they know the person for many years. They know the family for many years. They know the culture of that community as well. They can do physical assessment and mental health assessment. And also they look after people for many years in the future in case they have some more problems. So I think GPs are a good person to help with mental health. In fact, the recent Royal Australian College of GP survey called Health of the Nation says that GPs say in Australia, their most common consultation is a psychological consultation. So that's pretty incredible. More common than a cough or a cold. You know, this is very core business for GPs. I also think that, to be honest, working as a GP, it is a very rewarding part of the job because you get to help people and you can see them get better. And so that's why I was very happy to work in this area. We made, many years ago, we made a new education degree. It was with Monash and Melbourne University together called the Masters of General Practice Psychiatry. This was a 2-year course, and we had many doctors undertake this course. Actually, I think we had quite a lot of doctors from Hong Kong as well. But anyway, eventually we thought, oh, this is some really good material. We should make a textbook for the GPs. And that was the beginning of the book, General Practice Psychiatry, 上课医学的心理健康. So we're very happy with this book, very happy that it got translated into Mandarin. Now, we did something very special in this book. Every chapter has specialist expert and always GP, because the GP has very different perspective to the specialist. Firstly, they are seeing so many patients very quickly. So one thing I discovered in China was you don't have very much time to do a long assessment. You've got to make a decision pretty quickly. There are also many pressures on the GP to look after other conditions as well, you know, diabetes and heart disease and the whole range of health conditions, preventive care, vaccines, everything. So how does the GP squeeze in mental health care in this busy job that they are doing?
So you did a lot of work on the education, and this textbook is very helpful, not only for learning, but also in practice. They can check what kind of approach they can use and what kind of medicine they can use, and what's the more bigger context in the society, how to handle that in the community. I think that book is very useful and also very good for a very important reference for Chinese colleagues. So we're talking about.
I was going to say we were very happy when Huiyang could lead the translation of the book and got together some good colleagues. It's not a small job to translate a book, and I know Dr. Young's been involved translating Professor John Murtaugh books too. So we're very lucky, very grateful that he could do this for us.
Yeah, my pleasure. I'm also very interested in mental health. That's why we're working together. Yeah. So now we talk about a bit more about training and education. So a kind of background knowledge. So in Australia, in primary and secondary school, do they have some opportunity to learn mental health or some basic of psychology? Can you introduce this a bit?
So this is a very good question. See, what we found out is that if you look at people who have mental health conditions, 50% of them, that condition started before they were 14 years old. This means that looking after the children is a very big opportunity to help them avoid mental health issues. That's why in Australia, with Beyond Blue, who I'm privileged to work with, we put a lot of effort to help the schools, to help the teachers. So we have a program, it's on the web, called BU, BEYOU. And this is a whole lot of education, resources, videos, fact sheets, support for the teachers all around Australia so they can identify the kids that are having mental health issues early and help them and help the parents, because, you know, young people much more flexible, and it's a really good opportunity where they can learn some new skills and deal with some mental health issues that might come up. So yes, we're very committed to helping our young people. In Australia, also, we have another program called Headspace. So this one is very much targeted to the adolescents and young people. So from about 12 years old till 25 years old. For the same reason that we know if you put a lot of effort into sorting out mental health issues at this early stage of life, you can head off trouble for the rest of the life. So any young people can go to these headspace centers and get some support for mental health, which we think is a very good initiative.
So, so now we understand before the student go university, they already have something, some knowledge about mental health in their mind. So
Yeah.
yeah.
There was a big survey in Australia called Mission Australia Study. It is 25,000 students. And they found out last year and this year, the students rate mental health always in the top 3 concerns that they have. So I think the young people today, certainly in the Western culture, are very aware of mental health issues. And I think they are very, they're learning much more about what are these issues? What can I do to be resilient, to be strong, to head off mental health problems?
Okay. After the student go university, like a school, medical school, in the medical curriculum and in undergraduate curriculums, is there include the mental health course, or how do we teach medical students about mental health?
So I think that the students are learning more about mental health than they used to. So a few decades ago, maybe they would have a little bit of psychiatry training, but then again, they are mainly getting exposed to severe mental illness, like we discussed earlier, maybe schizophrenia, maybe bipolar disorder. So it's a very sort of biological, hospital-based perspective. Now, when they come out, we know half our medical students will be GPs. So half will be hospital specialists, other half GPs. But the sorts of patients they're seeing in the community are pretty different. Like we said, it'll be stress, depression, somatization, anxiety. And the skills you need to manage these sort of people quite different. I think these days there's a lot of improvement in the curriculum of the medical students. They learn a little bit about a technique called mindfulness. Maybe mindfulness actually derived very much from Eastern philosophies of meditation, and so, you know, in some ways,
from Buddhism.
That's right. In some ways, the West just relabel a bit, but it's really from the East. So this is very popular now, but also cognitive behavioral therapy, what we call CBT, is very good technique that they are starting to be exposed to a bit more. So hopefully they have some good skills when they finish medical school.
Yeah. So in the medical school, they have a further learning about mental health. And now you have involved a lot on the doctor training. I mean, the register in the vocational training. That's one of the in the GP curriculum. They include the mental health, of course, and also some doctors are very interested, like you, interested on mental health, because the GP has a special interest on mental health. So how they learn the mental health in this specific period of time?
So again, I think that for those training to be GPs, the first thing to remember is that the GP context is very different to the hospital. A lot of time pressure, a lot of competing demands. I think, the patients may have different view about whether the GP is a good person to help them even. But they are learning as GP registrars some basic mental health skills, how to do an assessment, how to provide some basic psychological help, maybe problem solving. And also in Australia, where GPs prescribe a lot of the psychotropic medications, then they would learn something about the common medications, the antidepressants and the anti-anxiety medicines, and also about some of the more strong medicines, the antipsychotics, those sort of things. So they are learning quite a lot of different approaches for managing mental health problems.
So, and also one of the interesting area of the GP training is how to work in team to handle the mental problems. Is that training contents in your GP training on mental health?
Yeah, look, I think it varies, but generally in Australia, the GPs are encouraged to work in teams. We mentioned in the case of mental health that the GP is encouraged to do the GP mental health plan, and this connects them in with the psychologist, connects the patient. So that is very good. So yeah, I think there is an emphasis on multidisciplinary care, because not possible for the GP to manage the patient always just on their own.
Yeah. Okay. So you are very experienced on GP training and also some community training. You have a very active in community who help people, especially in working in the Beyond Blue. And you also have a lot of experience to train Chinese doctors in Melbourne and also in China. So can you share a little bit of experience of you to train the Chinese doctor? What's the difference to train the Chinese doctor on mental health and you training the Australian doctor on mental health? Is that different or some similarities?
Yeah, look, I think there are some similarities and some differences. So first of all, I should say, because I had the privilege to sit in many GP consultations in China with Dr. Young, we sat on many consultations. And actually what I found out is human beings everywhere in the world are very similar. They have the same problems, of worrying, of not sleeping, of arguing with family, of being disappointed and sad about things that go wrong in their lives. So I think there is more similar about human beings than different. Seem like all the same problems. But then it's also overlaid with culture. And I think in Australia, because for many decades we've speaking very openly about mental health, there is the community very relaxed to talk about mental health. For example, we have senior politician or famous musician or football star always talking in the newspaper, I think I have depression problem, I had anxiety problem, I had post-traumatic stress. So it means that the literacy about mental health in Australian community pretty relaxed. My little bit of impression in China is still that there is quite a lot of stigma and people quite embarrassed to talk about mental health. Also the doctors, not just the community, like people not so comfortable with it. They think maybe mental health sign of weakness, or maybe a problem, the family should be embarrassed maybe, or, you know, these sort of beliefs, or that nothing can be done, or that if they just try harder, they can get better. So I think that, you know, these community beliefs are very important, because if we think about the patients coming to the GP, when I spoke to some of the Chinese GPs, they said if patient came in and they said, I think you have depression, then first of all, the patient may be angry and maybe insulted. Why you think I have a mental problem? I'm never coming back to you. You are a terrible doctor. So, I think that we can't ignore the cultural differences when we're talking about mental health, because it's so different. But then at the same time, the Chinese GPs tell me, and I've seen it, they have a man, he has back pain, he cannot sleep, he's very sad. That the lady, she's anxious, she's crying all the time after she had a baby. She probably has postnatal depression. So, it's not that they're not experiencing the same sadness as everybody else, but just different belief system. I also think different beliefs about what is the role of the doctor. So in Australia, many patients have high level of trust in the GP because the GP has been there a long time. And also I think the specialists understand that the GP is important part of the system. In some way in Australia, it feels a little bit like the GP is the boss. What I mean by this is, you are my patient, and I say, oh, you have stomach problem. I'll send you to this gastro specialist. He will fix it. He has to write me a letter back. And I say, okay, thank you very much. Now my patient comes back to me. So like the GP is like the center. My little bit of impression, because general practice more new in China, that maybe not as much understanding from the specialists what is the job of the GP, and also the public not as sure, can I trust the GP, or should I just go to the hospital for everything? So I think there are some big differences in attitude in the community, in the doctors, in the specialists. So I think this take a bit of time to build up the credibility, the role of the GP. So that not just relating to mental health. I think this is a general thing, right? Now, having said that, the GPs I met are very skilled doctors in China. They have seen thousands of patients. They are very intelligent, and they know that there is a lot of psychology going on in their relationships with their patients. So they have a lot of experience. So I think when you are teaching GPs in China, you have to remember to how much experience actually they already have from just seeing so many patients. They know a lot about the attitudes of their patients and what is going on. So, but rule number one is value the experience of the doctors. They're not silly. They have a lot of experience. So the first thing I would say. Just a second point to make, I think when teaching mental health skills, it's very important to do role play. So if someone goes to a lecture about depression and they sit there almost falling asleep, listen to the professor, he's just talking at them, lots of PowerPoint slides. This will not help them very much. Much better is if they listen and then they go, okay, now we do role play. You pretend to be the doctor. This one pretends to be the patient. Now, practice doing mental health assessment. What questions are you going to ask? And then they practice. So in that way, they are learning the skills to ask the right questions with their own words. And I think this will translate more quickly to their clinical work.
It's a very good experience. And I also think that also very useful information for Chinese supervisors when they teach the students or doctors on mental health. So more role play and or more active learning and group learning. I think that's it's a kind of challenge from the tradition, but also I think it's very useful to encourage our supervisor and teacher to learn more education skills, not only the mental health, but also more other general practice skills and knowledge.
Yeah, I think that's true. One other important thing I think to say is maybe someone GP would be thinking, why do I have to worry about mental health? I have enough job to do. I'm managing diabetes, I'm managing heart disease, I'm very busy. Already the patient's very demanding. When I've been in China, also in Australia, you see some of the patients get very angry, have a lot of expectations from the doctor. But they should always keep a hopeful attitude that people with mental health problems can get better. And this is why I like working in this area. You can have someone with panic attack, and then they learn CBT technique, and they're like, oh my gosh, I can manage this. I can get on with my life. Or you have someone with severe depression, like the patient I told you at the start. We put him on some antidepressants. After a few months, he's much better, and the suicidal thoughts went away, and he's working again. And, so we should feel very hopeful that this is an area that we can really help the patients a lot.
Yeah, agree. I think now in Australia and China, nobody say mental health is not important. So, but the solution have many aspects, like training, motivate the people to speak out, and also some financial incentive. Like you mentioned, Australia have a mental health care plan that the government will pay to the doctor if you do the plan and refer to the specialist. So this is a kind of very interesting incentive. If the medical doctor income is only depend on how many patients you see today, so it's kind of favorable case. So it's a no incentive for doctor to spend more time on talking to the patient. So this is not good incentive. So I said it's a negative incentive for the mental health. So there are a lot of efforts on this mental health in primary health care. But I think the training is a basic. So we need the doctor have a more capacity and solid knowledge and experience to handle the mental health, and also to help people who not only the severe problem, but most likely is the mild and so some moderate problems in the community, even at the office, general practice office. Okay, thank you, Grant. And it's a very good talk. We talk about your experience and very interesting case studies, include the COVID-19 anxiety. And also we talk about your experience on how to write book and the teaching in undergraduate student, and especially in the GP training program. Very uniquely, you have rich experience to teach Chinese doctors in Australia and also in China. And this talk is very interesting for all of our audience, because they try to improve and to strengthen this area, not only the physical, the biomedicine, but also the mental health.
Yeah, well, always a pleasure to work with you, Hui, and hope this will be very useful to our good friends in China, and look forward to visit soon and to catch up with our good friends.
Yes, exactly. We really hope that we can come to China together and to meet our Chinese colleagues to share experience on not only the mental health, but also primary care and general practice and many other areas. Thank you, Grant.
Bye.